probably not getting him towards his long-term goals. So I'm glad
Telemedicine has been around for a while, the whole video conferencing, and some fields in medicine have used it more than others. So mental health providers have used it to have interviews. But in most clinical practices, it's been available, but we haven't had to use it, so we didn't really adjust to it until it became necessary with the COVID outbreak.
How are things going over in Lanai?
I'm Dr. Kenrick Moriyama. I'm the chair of the Department of Surgery for the John A. Burns School of Medicine and a physician at University Health Partners of Hawaii, the faculty practice for the John A. Burns School of Medicine. We live in an island state, and I think one of the things that we are really moving forward with is the ability to provide that first level of interaction with the patient and engagement on telehealth before they fly over and we say, oh, you know, you should have brought this with you, or we need your spouse to come with you, or you should have brought these studies with you. Now we can kind of plan that so when they actually make the trip over, it's actually a very worthwhile visit for them.
Bringing him back on track.
It actually allows people to get some health care without completely disrupting their day. So if you have kids at home, pets at home, elder care at home, this actually allows us to kind of see them in their element, but also allows them to have that engagement with the provider without having to arrange for all that other care at home for the family. When you have elderly patients, if you do telehealth, they're often at home with their significant other, their care provider, so you get to interact with them and get input from their care provider as opposed to if they come in, oftentimes it's just them.
The right thing for
In this whole COVID era, we've become very self-conscious about minimizing exposure for the patients, but also for our staff. So it has allowed us to provide care and interact with patients without exposing them to the potential risks of coming to the hospital or to an office. It's also helped us minimize the risk to our staff of potentially being contaminated if someone's sick when they come in. The downside is it's hard to examine people. You can't do a good physical exam. But you can actually come up with, ideas about a diagnosis. You can review studies with them so we can share the screen and show them the x-rays. And then you can go over their labs with them and then come up with a plan and then decide, do you need to come in for an in-office visit or can we continue to do this? I don't think we're ever going to go back to the way we practiced. I think the more providers figure out how to use telehealth or telemedicine in their practices, the more efficient they'll become. So right now, OBGYN, internal medicine, family medicine, psychiatry, surgery, and University Health Partners of Hawaii are all being encouraged, and we are all adopting telemedicine as really not the future, it's the present, and the future just is going to determine how much we're actually going to be able to use it or can use it.
Brought to you by University Health Partners of Hawaii and the John A. Burns School of Medicine.